team, and I am here as the team lead for the emergency room. We were previously known as Team 2, but we are now the A team, as you can see. We have, for those who are old enough to remember, the A team, they came through in tough times, and they always produced results. So I am, as the team lead, we will have a talk time of 20 minutes to provide the report on our activities in our last week. And we will be all participating in our presentations. And this is our team, the A team. And certainly we have had an opportunity to have a group of individuals from Tony Weeks from 3S Health, Amy Keys, our vendor from Covidin, Lori Bolotnik, our nurse educator from the emergency room, Tracy Hobson, our nurse educator, our nursing unit manager, Rick Lederhouse from materials management, Corrine Hawk from the Health Quality Council, John Piggott as the VP of Operations, Anton from the KPO, and Jim Crawford from 3S Health. So I am now going to have our team members present our results.
Thank you very much. So yes, my name is Tony Weeks, and I'm a proud member of the A team. So I'm going to start with presenting our project form, and I'm not going to spend a lot of time on most of the detail because you're going to hear a lot of that from our team members, but I do want to focus on the current situation and why we are here this week and what we've been focusing on. So we focused on two areas in the emergency department. One is the emergency room supply room, formerly known as the storeroom, and secondly is the ER trauma rooms. And so we narrowed our scope to one shelf, because there was so much inventory in the supply room, to one shelf in the supply room and to one shelf in one of the trauma rooms. And our intention is to perfect that, harmonize it, get it socialized to staff, and then replicate it throughout the rest of the space. So that's what you're going to hear a little bit more about. This diagram shows the PAPHR state, and it kind of gives you an idea of the footprint of the spaces that we're working in. So I talked about the ER storeroom, and the area that's highlighted, the circle area, is the shelf that we're focusing on in this week. And in ER Trauma Room B, that's the shelving unit that we're working on as well. So you're going to hear from our members today the improvements that we've made in both of those areas. I'll pass it off to Rick.
Thank you, Tony. What we did when we were looking at these two storerooms, the first one that we looked at, and this one is actually Trauma Room B. This is a pre-Kanban that we had done and a post-5S. This area is the area that we were working on just in the trauma room alone. We had some issues in that trauma room that we identified, and some of them were that we were looking at about 20 square feet in this shelving area, and we looked at reducing it by at least 50%. We wanted to do that. There were 893 total pieces of inventory in that small area, and we also wanted to reduce that by 50%. The delivery time into that area was, again, around 72 hours to replenish, and we were going to reduce that as well. The other thing we looked at, there was some issues there, occupational health and safety issues with the shelves being too high, and we wanted to lower those to a more reasonable and safe level for people. In the other room that we looked at, this is our main storeroom that Batman delivers to, and this again is a pre-Kanban photo of that area. It was loaded with a lot of supplies, and we had a lot of work to do there to make some reductions. What we looked at there, that's 38 square feet on those shelves that were there. What we looked at again was reducing that square footage by at least 50%. There were 749 total pieces, and we wanted to reduce that as well, and our goal was 50% to do that. We did find a defect in that area. There was one product, 4 individual items, one product that was a defect, that we found that was put on the wrong shelf in the wrong place. So we're looking at reducing defects to 0. Again, we're looking at productivity gain. What was happening is our nurses were spending 24 hours a year delivering product from that supply room into the trauma room. We wanted to reduce that to 0 for nursing, to reduce that. And again, in that area, we also found a safety issue with the shelves being too high and people having to reach too high. So from an occupational health and safety perspective, we wanted to bring that down to a safe level as well. That's our pre.
Hello, I'm Corinne Hack. I'm from the Health Quality Council and I was a participant on the team. So you can see from this visual that's up here, as Team 1 indicated, before we came into Kanban week, we had some preparation that we needed to collect some information about usage and so forth so that we could decide what we needed as we went into this week. We found out during that preparation period that we had in the supply room 613 pieces of just-in-case inventory, which equated to $3,383. In the trauma room, we did a preparation, and here we put the signal Kanbans, and in there we found out that we had 454 pieces of just-in-case inventory. We did not add a dollar value to this because all of the supplies coming out of the trauma room would be going back into ER supplies, so it wouldn't really be a savings for the department itself. It would just be redistributed somewhere else within the department.
And I'm Tracy Hobson, a process owner, and for those of you that know me, volume is not a problem, so I'm not going to use the microphone. I'm going to talk about the idea summary sheets that we produced this week. The first one had to do with trauma be the patient care area that we were focusing on. Problem being too much inventory and more so no standard process for restocking of that area. Typically you see something was empty and the nurse would go get it. They'd see something else was empty, the nurse would go get it, resulting in a lot of wasted time and footsteps. So we 5S those shelves. We implemented a signal Kanban system and made a standard worksheet for restocking of that area. Resulted in reduced inventory, the implementation of the worksheet, and restocking reduced steps for the nurses and ultimately for the other ER staff member that we now incorporate into this role. Our next idea summary sheet had to surrounding the supply room. Again, it was overstocked by 537 pieces, which is a cost of $3,200. It was disorganized, and as Rick was saying, there was some unsafe work hazards there for the staff. So we reduced the inventory. We implemented both a 2-bin and a signal Kanban. And we also, as you can see in the second picture, we removed a shelf on the area that we were working. A few times since we did our original 5S to now, we would come in and there would be, of course, people like to hoard things and stock things, and there'd be stuff on that shelf again. So just to make sure nobody fell back into that pattern, we just took that away because it's very hard for the staff to reach and unsafe. Our last idea summary sheet that we are most proud of, and we did get a very good yesterday by the sensei when we introduced it, was implementing of a rolling suture cart that we will be able to use throughout our department. When we were looking at the shelf in the trauma room, it took up, the suture wrap area took up quite a large volume of space. There's lots of inventory in there. We have the same amount in A room and ortho. And hopefully as we roll this out, we'll be able to take that inventory stock away from those areas as well. We've got a suture cart, which we are going to improve on. That's one of our paper sheet summary sheets to get a little bit more user-friendly. It's completely stocked with sutures so that we can take the supplies to the patient. Lots of times we're doing unnecessary movement of patients, taking them to the appropriate rooms. Now we can take those supplies to wherever the patient may be in the department. I think that's enough for that one. This is the after process of the flow. The one to the supply room doesn't change a whole lot with the material management. We have implemented another ER staff member, the porter, incorporating a little bit more into their role, so their steps have to be kind of considered in that. For the ER trauma room, we have implemented a Kanban post and standard word, which Lauren will go into in more detail. But basically, we are reducing the steps of the nurse there, as well as the porter who will be supplying that room, just by having more standard processes. We're not making 25 trips a day, but hopefully maybe down to 2. This is a room, a picture of our supply room after the Kanban, showing our Kanban cards. And the picture on the right just shows something that our very craftful team has come up with as a dispensing unit prototype, just to make it easier for staff to dispense the supplies that they're looking for. And here's a before and after trauma B, which is our other area, and you can see the top of the sutures, and I hate to say this was 5S, so this looks better than it did previous to that. So you can tell even with continual improvement how much work you can keep doing and things just keep getting that much better. And the visual cues and just how much more organized and lovely that looks. And now I'll turn it to Laura.
My name is Lori Blotnick, and I am the content expert for the emergency department. I'm going to discuss and tell you guys about the standard workflow we created about this change. There are two separate processes. There's one that is in the supply room, and there's one as well as in the trauma room. I'm going to discuss the supply room one first. It has a two-step process. There's one where it's a signal Kanban, and when the item that is depleted, the nurse will take the Kanban signal card and put it in the Kanban post, as you can see down at the bottom. This is our temporary Kanban post until we get a more appropriate one in place. There is also another step where it's a two-bin Kanban process. When the one bin is empty, the nurse then will take that empty bin, put the bin on the shelf at the bottom of that cart to signify to stores that items need to be ordered. So from there, when stores comes up, they have agreed to come up 6 times a week, Monday to Saturday at 8 a.m. And what they will do is they will retrieve the cards from that post, as well as the bin. They are going to take their check sheet and identify which items it is they need and in the quantity they need. They will then turn the card over, put it in the right-hand side of the Kanban post, put the empty box on the right-hand side to signify to their staff that it has been processed. From there, then, they are going to go and fax that information sheet down to materials management so that when they are able to start assembling it before they come back up at 10:30 to replenish that stock. As well as they're doing that first in, first out basis. So they're going to take the old inventory, pull it forward, put the new inventory in the back. I think there might be another picture next. Sometimes some of our items are on back order, and to decrease confusion amongst everyone, Materials Management is going to fill out a form saying that that item is on back order, and they're going to put it, it's called a tent card, and they're going to put it in that designated area telling us when that expected delivery date is, or if there is a substitute for that product. The next standard workflow I'm going to discuss is in the trauma room. The trauma room now is a single Kanban process, and when, again, those items have been depleted in the front portion of those bins, the nurse then now only has to take that card and walk a whole, 10 feet to the column and put it in the Kanban post. Again, this is a temporary Kanban post. We're going to have something that looks a little bit more appropriate. From here, then, the porter is going to check this Kanban post every morning at 8 o'clock. They're going to then walk to the supply room, retrieve the items they need. And how we've made this easier for them is on that Kanban card, it's going to tell them specifically where that item is located in the trauma room. And then when they go to get the stock from the supply room on the reverse side, it's going to tell them where it's located in the supply room. So it expedites their process in retrieving and then restocking that item. If one of those items is on back order as well, we don't need as much information as you need in the supply room. So the porter will put this little Kanban tent in the trauma room signifying that item is on back order as well.
Good afternoon, everyone. I'm team member John Higgett, and I'm going to bring back to you the form that you would have seen with Rick when we started. And what I'll do one for each of the supply rooms that we chose to Kanban, and the trauma room B, which is of course one of the rooms in the emergency department that are serviced out of the supply room emergency. First thing I want to point out to you is that invariably we had a target that was 50% or greater. If you look to the right-hand side, in certainly more than half of our targets, space, inventory, the 5S, we achieved more than our target. And so, you know, without going into too much detail, again, we have reduced the space taken, inventory. We have also increased for materials management, the delivery schedule for materials management. And if you'll switch to the next one, Cecile. This is the similar target progress final report for trauma room B. And so there you can see our percentage change reductions, 50%, 39%, 80%, 100%, 75%, and actually in our 3S, 180%.
I'm Jim Crawford, I'm from 3S Health. I'll be talking a little bit about the inventory levels and some of the statistics, and we've graphed some of these accomplishments out. On the left-hand side, there's the actual inventory number pieces. And if you go along the bottom axis, it's pre-5S, post-5S, and post-Kanban. So the blue line, it indicates the ER supply room where we started from 973 pieces. We got it down to 280 pieces, which was a 69% reduction post-Kanban. And the red is the trauma room. And we started out at 749, we got it down to 454. So that was a 39% reduction in overall number of pieces for both areas. The next area we're looking at here is actual values of that inventory consolidated. We started at $4,698, and we ended up in total inventory in those areas down to $1,315, which was a 72% reduction in inventory values.
My name is Amy Keys. I work for Covidian, one of the vendors that does business here in the health region. So again, without going into too much detail, this is kind of a busy slide, but basically our biggest target was to improve the flow of everything, but basically to free up nurses' time to do the job they're supposed to be doing. And we really did achieve that. So in here, there's quite a few things that we're going to be working on continually. But first of all, and I think this probably goes for all of us, but is that you really need clinical support and consultation with everybody that's going to be involved in this. So with Tracy and Lori and doing the education of all the nurses and the staff in there, I think that's the biggest one. And actually they've already been starting on that. Things have been going well so far. There's just a few specific items in there, but our lovely materials management department is taking on a lot of this work. So you can see there's quite a few items allocated to them. But again, they've been really willing and eager and have got a great start on this as well. And just back to Cecile.
So in summary, and before we get into the specific items, I really want to thank my team. We were not all familiar with each other, but we gelled over the week. And in fact, we had a few patients who wanted to also participate and go get stuff for us. So it was very, I think, gratifying. And certainly we know that perhaps in a different time, we may have needed to add the ambulance staff, because they are also staff who participate in this area and also work with the team and get supplies from this site. But in summary, certainly timely staff and physician two-way communication and the workshop preparation supported our Kanban success. managed change, and I don't know if that should be managed change or managed chaos, and ongoing respectful communication throughout the Kanban week was critical. We used our skills around Plan, Do, Study, Act, and simulation again was critical for our success. What we thought versus what actually happened really did inform our success. Our team composition, and certainly you've been introduced to them all, but our team came from 3S, from this facility, from the senior management team, and I think the created dynamics that supported our work, and the expertise in this team also added credibility for future quality work in the emergency room. And I think that our last summary would be that, and this was Lori's just very positive thoughts, is we began this week as individuals, and we left as a cohesive, informed team. So, I never thought I'd want to cry. We might have wanted to cry during but I really think that, as Lori and many of the people said, we're a team, and it wasn't easy. We got to know each other, and I think it's been a very strong, positive week. So, our thank yous, most of all to our patients and our families. And Lori told a story about a patient who wanted to go get stuff and help us. And as we were marching back and forth between the two rooms, one of the patients said, well, I can go do that. I can go get that for you. I think we really need to give a strong thanks to our emergency room staff and physicians. They stopped, they did whatever they had to do, gave us information, and actually stepped right up and participated in simulation without lots of advance notice, and were there for us. Our maintenance staff who came, and I think we're pulled in many directions by our Kanban teams throughout the facility, but we're also pulled as the water was flowing down the walls in the Herbacid room, home in some of our resident staff. So they managed to do it all and continue on with a smile. Our other Kanban teams and their members, we actually heard lots of excellent ideas between teams through the report out, and I think that expertise in those other teams helped us be better. And our KPO staff, Anton, thank you. The Victoria Hospital staff, dietary, and all of the folks who got out of the way, said, oh, you guys are busy, go ahead. Those staff and physicians we do need to thank also. Sensi Nurati and Numata, and let's go. Or let's go. They keep saying, say like let's go, and let's go. Thank you very much. John, Dan, and Andrew, and your organizations who left people behind to do work that gave you the opportunity to be with us today. Thank you. So on behalf of the whole team,